Hello and welcome, my name is Chris from christopherhole.com. Welcome to this video where we're going to be talking a little bit more about patellofemoral syndrome. First of all, we're going to talk about what it is or describe what it is. Then we're going to look at some potential causes. Then we're going to look at some potential treatments. So first of all, patellofemoral syndrome is the degeneration of the posterior surface of the patella. So you can see here the kneecap, also known as the patella, is here. Then you've got obviously the posterior surface is the sort of the surface that is facing the femur or the bone of the upper leg. Now, when this surface starts to degenerate, then you get your patellofemoral syndrome. So when we are, I guess, or when you are diagnosing um, this, it's very much trying to make sure that it is this, because there are a lot of aches and pains that people can get around the knee joint. So it's worth exploring those unless you can actually get to view the posterior surface of the patella through something like an MRI scan, where you can actually see that it is degenerating. So that's not to say you haven't got it, it's just to say before you actually go with a definite treatment plan, make sure it is what you think it is, if that makes sense. So some potential causes. You've got Q angle. Now this is more so, I guess, with females because they have a wider Q angle, and the Q angle is basically the angle from. So if you could imagine the pelvis here, females have wider pelvises, which basically means their knees come sort of inward more than males might. But you do get females with narrower pelvises, which won't be affected by this as much. But basically, the Q angle is the angle from the knee up towards the pelvis. Then you have tight quads and ITB. I don't like to use ITB. I would rather say hip abductors and adductors, if that makes sense, or not adductors, but internal rotators. Then you've got a disparity, so an imbalance within the quads. So the quads on the outside of the leg might be a little bit more active than the ones on the inside of the leg, which then will come into weak abductors. They're on the outside of the hip, and then you get an overuse and repetitive trauma. So that can be quite a lot to take in. But basically, your first treatment plan is to correct the underlying cause. So it might, if you've got a Q angle that's greater than 18 to 20 degrees, then there's not a lot you can do about it. That's your bony structure. So it's very much being able to manage that. But then it's exploring: do you have tight quads? Are the quads on the outside of your leg a lot sort of tighter and sorer than the ones on the inside of your leg? So it would be very much using something like a foam roller and stretching through the quads. Also through the adductors to loosen those off, which will then allow you to activate your abductors, if that makes sense. And then what we've got to think about is the overuse and repetitive trauma. So in some of my other knee injury videos, I've talked about traumatic injuries that happen from one impact. Now, patellofemoral will go back to the principle of the straw that broke the camel's back. So it's something that happens over time, it's repetitive, and it's minor traumas, and then eventually it just wears it away, and then you start experiencing pain. So with regards to treatment, it's correcting the underlying cause. So thinking about your quads, your and your abductors and your adductors, stretching the muscles that are tighter, foam rolling the muscles that are tighter. If you can get to see a good massage therapist or good therapist, then use one of them, because again, they will be able to manipulate the tissues that much more effectively than stretching and foam rolling, and then you can use that to supplement what the therapist is doing. So just to recap, patellofemoral syndrome is the degeneration of the posterior surface of the patella, but make sure that's what it is before you go about treating. Some potential causes are Q angle, which when it comes to treatment, there's not a great deal we can do. There may be some foot positioning that we might be able to do, but that depends on the way your ankle, knee, and hip are aligned. Then you've got disparity between lateral and medial quads, so the quads on the inside and the outside, weak abductors, overuse, and repetitive trauma. Different ways of treating would be correcting the underlying cause, which is what we've talked about here, stretching, foam rolling, and massaging. So hopefully that's been helpful. Hopefully you've got some potential new ideas or new insights into what it is or what your knee pain is. And hopefully it's given you a little bit of structure as to what you can do with regards to a treatment. So many thanks for watching. My name is Chris from christopherhole.com. I'll speak to you in a future video.